Good morning. It has been a while since our last video update. Our Serving Oxford Safely plan remains in effect, as does the mandatory face covering requirement, both inside and outside in public places. This includes the downtown square area and any other public space. The exception is for those exercising. You are not required to wear a mask if you're exercising. Our numbers are increasing daily. Today, we stand at 1,791 total cases since March. We saw an increase of 13 just yesterday. Our death count stands at 38. We report that number daily, and I fear it becomes just a number, but those are 38 members of our community that we have lost to this virus. 26 of those deaths were at our veterans' home. You know, we're a retirement community, and we do have a vulnerable population. We are also a community that is made up of a large student population. We understand the importance of both of these populations in making our community the amazing place it is to live, work, visit, and go to school. Those two large population groups have very different concerns in regards to this virus, and they both affect the other. As I've relayed to you in each update since March, we continue to be advised by state and local healthcare providers and officials that our focus should be on protecting our healthcare system from being overwhelmed. That's why we talked about flattening the curve months back. Our community embraced the needed steps and did that successfully. We knew that as students came back to town that numbers would certainly increase. This was not unexpected. We are advised now that our focus must be on hospitalization bed availability, both in regular beds and ICU beds and ventilators. We are watching these numbers daily and speaking with our hospital administrator. There have been days when the capacity was stretched, but not one person has been turned away from the ER. As of yesterday afternoon, there were 10 people in ICU, 6 with COVID-related illness. There are 24 ICU beds, which means 14 ICU beds are available. We have a total of 181 beds staffed at Baptist Memorial Hospital, North Mississippi, and today 65 of those are available. Yesterday afternoon, there were 29 that were hospitalized with COVID. Hospital Administrator Bill Henning stated that very few under the 29 years old age have been seen at the hospital. Overall hospitalizations are down. We were seeing daily hospitalizations of COVID patients. We were seeing those in the 50s a month ago, and they're back down in the 20s now. I've gotten many calls and emails and social media comments about the university bid day activities. Anyone who has seen social media has seen large groups of students without masks hugging and posing and taking pictures. I spoke with Chancellor Boyce yesterday. It had been my understanding that the fraternities and sororities were not having large gatherings, as this is a clear violation of the governor's order. Chancellor Boyce called to say that unfortunately a university official gave permission for this to happen. I'm extremely disappointed that after the hard work that our community has put in, that this would be allowed. Chancellor Boyce assured me that they are addressing issues of social gathering violations across the community through their Student Conduct Office. It's my understanding that students found in violation are fined and required to do some educational work. If the person is a repeat offender, it's my understanding that they would be suspended. We have had calls from our community to enforce mask wearing and social gathering rules. Oxford Police Department is enforcing both the mask requirement and social gathering requirements. OPD has issued 42 violations for not following these guidelines in August, and they've already issued 18 in September. And we promise that we will continue to strictly enforce these requirements. I've talked to local physicians, Dr. Eric Richardson and Dr. Jeff Dennis, to get information on what they are seeing and, where they believe transmission to be the highest in our community. There are so many different philosophies, and as you all know, there are recommendations from both national and state healthcare officials that change daily. We have certainly learned since March that we must be fluid and willing to change our direction once data indicates that a change is needed. We've been asked by community members to close indoor dining. If we were being advised that transmission was being tracked back to these establishments, we would cease to allow indoor dining immediately. That's simply not what we're being told. We have a very firm plan in place. As our positive cases are increasing, our hospitalizations are actually decreasing. We cannot regulate full compliance as hard as we try, but we do believe that that's where our problem lies. Yes, the Board of Aldermen has one trigger that can be pulled that would take us back to our Phase 1 plans of sheltering in place and only allowing curbside or delivery for our restaurants, so people are encouraging us to pull that trigger. It's human nature to want to do something right now, but the information regarding our hospitalizations and severe illness from this virus is not indicating this would be an effective trigger to pull. We don't want to be reactive. We want to follow the advice of our local healthcare providers as we have done since March. At this moment, we are not being advised that stronger restrictions will provide lower hospitalization numbers. These plans are fluid, as I've said, and if that changes, then we will take action immediately. We are working with our downtown restaurants to provide space for outdoor dining in the coming weeks. This will allow our restaurants to serve people safely outdoors and increase their revenue potential. This is something that we would recommend for restaurants across our community to implement. We are working with the downtown restaurants as they will need to use city property to make this happen. Restaurants across the community can use their privately owned parking and outdoor areas to offer the same. You know, for those of you who have not ventured out yet to a restaurant, they are seating at 50% capacity. They are social distancing between tables. They are not allowing people to stand and socialize in bars or restaurants. And most nights OPD reports that it's not crowded at all. The contact tracing indicates that the spread is coming from social gatherings. If we want our caseload to decrease, then individuals must accept responsibility and control their own behavior. The New York Times headline yesterday was, "Parties and COVID-19 outbreaks threaten university reopenings in the U.S." It does. The increase in positive cases is concerning, but as I said, it was not unexpected. When you bring 15,000 people in as new residents over a week, cases are going to increase. This age group is seeing the fastest transmission across the country. As we analyze data, we find that more than 60% of our new cases over the past 2 weeks have been between the ages of 18 and 23. A message to our students. We really are glad that you're here. Getting thousands of excited young people every August is something that we all look forward to and treasure, and we want you to be able to stay. We want you to enjoy the Oxford and the Ole Miss that we all love, but we desperately need your help to get there. Please act responsibly. Please wear your mask. Please get tested and quarantine if needed. Consider that you may be asymptomatic, but you may be putting others at great risk. And to our community, we must keep up the good fight. You have been so dedicated to helping us get to the other side of this virus, and we thank you. Thank you to our businesses who are working so hard to implement the necessary safety requirements. We will get through this. The numbers are frightening, but we must remain focused on the hospitalization data and take comfort in knowing that those are going down. We still recommend for anyone in a high-risk category or age range to stay at home as much as possible. As a board, we will continue to review data. We will continue to speak to our local doctors and our hospital administrators daily. We are stronger together. Thank you.